Hello, everybody. Hi, scan out. I'm Dr. Naomi Lee, and I am going to present on my journey from the reservation to where I am now at Northern Arizona University. Actually, physically, right now, I'm sitting in Oklahoma. However, I live in Flagstaff, visiting my husband who's stationed at Fort Sill. So I apologize if there's any background noise. I'm sitting outside on this wonderful day. You can probably see my reflection if you're of people walking by. So I wanted to leave my camera on so you know who is speaking to you. Here's my contact information. Feel free to reach out to me by email, phone. You can follow my lab on Twitter or check out our website to learn more details about different projects and students that are in my lab right now. Before I get started, we always want to acknowledge Northern Arizona and the fact that it sits at the base of the San Francisco Peaks. You can see them in the background here. So we always want to honor our past, present, and indigenous generations and those that are that call this area in Flagstaff home for many generations. So this is actually my building when I'm at work. You can see this orange building. This is where the chemistry department is primarily housed, as well as other faculty. So in the next 20 to 30 minutes, I'm going to walk you through my journey. As I said, I'm Onotowaka or Seneca, and as I recall, many of you may be from this region, and in fact, we may actually be relatives from the same tribal community. So again, feel free to reach out to me with any questions. I'm going to talk about all of these different icons and how I participated in research and what I did, and just gloss over what I'm doing now here at NAU. And my journey really shaped what I do now as a researcher and a faculty member. So my career goal in research is essentially to improve the health of Native Americans through different types of research, so biomedical and public health, as well as STEM education, and then mentoring our next generation of Indigenous researchers. And so I run various different programs for high school students and early undergraduates, as well as my regular research program that focuses primarily on vaccine design using chemistry and biology, but I also do a lot of work with tribal communities now. And my motivation for this can be really summarized in this Lakota prayer, which is do this so that the people may live. All right, so like I said, I was born and raised primarily on the Cattaraugus Seneca Nation Reservation, which is this little one right here. This little dot, it actually runs into Lake Erie. And again, I lived there almost my entire childhood. And so family really is my foundation, and how you define family can be broad, right? So that could be your genetic family, but for me, it's all of those individuals that have supported me throughout my career and my adulthood till now. And so that includes, my best friend who still lives in New York, my aunt and uncles, or my aunties and uncles as well. And then here's my husband and my stepdaughter. These pictures are a little old. My brother and one of his little girls, and then this is my father here, and my mother. But again, this is just some of the individuals that have supported me. And again, here's a close-up of the reservation that I grew up on. And if you're not familiar with the Haudenosaunee, we are people of the Longhouse. So this is actually one of our traditional longhouses that is located near Rochester, New York. So unfortunately, I know this is a virtual conference for all of you, but hopefully you're able to make it out to Rochester and visit the traditional longhouse in the future. Right, and so for those of you who have also grown up with a similar background, you may also be a first-generation college student like myself. My mother did eventually go to college later in her adulthood, but she did not really enter the workforce for too long before she actually passed. And as far as medical professions, my only exposure was really IHS. right? So Indian Health Service. So this was what the clinic looked like, and it's still there. It's a different building now on the reservation growing up. And then you can see now this is just one of the different facilities that they have out there. So it's drastically improved since I've moved off of the reservation, and they've done a lot to help with our tribal members that live on or near the reservation. But I never really met any Native professionals. There might have been some different natives that worked at the healthcare facilities. So I never really saw myself as a healthcare professional, but I was always interested in the STEM fields. I was always good. I had an interest in science. I just didn't know where to go with it because I didn't have those mentors. Unfortunately, also growing up on the reservation, my family was constantly bullied. We were threatened with violence. A lot of this had to do with the fact that I am biracial and that my mother was white. And so on the reservation, we experienced racism. Off the reservation, because we look Native, we experienced racism. And it was just a lot of unnecessary stress. And unfortunately, we're seeing it now even today with the recent violence that we saw down in Florida. But otherwise, I thought growing up I had a good childhood. I didn't really notice that things were bad because I had loving parents who kind of shielded me from those experiences. So it wasn't really until I became older and I was able to reflect on some of the negative things that happened throughout my childhood. A lot of that actually stemmed around family illness. So both my parents were always extremely ill. I didn't know my paternal grandparents. They had died before I was even born. And my maternal grandfather had actually passed when I was young. So I didn't have a lot of elders directly in my family. There were those that surrounded me on the tribe. And so among my actual first, my parents and closest bloodline, we experienced diabetes, heart disease, stroke, cancers, various rare neurological disorders, and even those including Alzheimer's and Parkinson's, and then also arthritis. And so when I saw that the only individuals that could care for my family were typically non-Native, that's again why I never saw myself as a physician. But eventually, my mother really pushed for all of us to go to college, myself and my siblings. And so I ended up going to Rochester Institute of Technology, where I have my bachelor's in biochemistry. And that's also when I first became involved with AISES, was as an undergrad. I might have been in my junior year. And so while at AISES, while at RIT, I really still struggled. At first, things were great. I made Dean's List. I was having a fun time away from home, but things started to go downhill, especially as my family was my mother was diagnosed with breast cancer for the second time. The first time I was still in high school. My father was going blind due to his neurological disorder. I had to do work study and take out loans, not only to help cover tuition, but a lot of that money I was actually trying to help and support my parents who were sick. And then, it really took a toll on my GPA that first year. I went from Dean's List and literally cut that GPA right in half. The second, well, back then there are quarters. You're on semesters now after you're at RIT. So I was having a lot of issues with self-image, cultural identity, self-identity. I had parents who I couldn't turn to because they were ill. And so I was feeling really disconnected and isolated as a student at RIT. And when I was there were only a few Native students, and now it's one of the largest student populations, especially at a private institution. And that all had to do with RIT taking the initiative and hiring new Native faculty. So Dr. Jason Yonker, who I know is no longer there, I still keep in touch with him. He's one of my great mentors. He and other faculty took me under their wing and really helped to point me in the right direction. And that's when I became interested in AISES. And so after I had left, the Future Stewards program had started, but it was in the makings while I was still there. and so it was really great to have that support through him and the other faculty in this program that is still ongoing now. And so it wasn't really until these mentors came along that I started to have some direction in my life. Like I said, my parents were very ill. I felt isolated, and my faculty there I was not close to, and so they didn't really know what was going on in my personal life. And so I did eventually join some research labs at RIT, and that's where it sparked my interest in research. I didn't really know what it was until I became involved, and then I continued in different labs throughout my senior year. But while I was there, that's when Dr. Yonker really encouraged me to apply to graduate school. You know, he's like, if you want to be a doctor like me, you have to get a PhD. And I was like, what? What is a PhD? What does that mean? And so I only applied to a few universities, and a lot of that had to do with I didn't know where to go. I didn't know where to look for PhD programs. And in fact, I applied to the University of Rochester, which is right down the street, and one of my faculty members in the chemistry department, she's still there. She was a recent graduate and encouraged me to apply now. In fact, we're actually working together on some projects. So it just goes to show that you want to maintain those connections and continue to build bridges with new individuals, because you never know when you're going to circle back around and call them colleagues instead of your faculty. And then again, I'm very supportive of RIT and the Future Stewards program. I try to be involved as much as possible. I think it's a great program for students. And so I did end up going right from undergrad to grad school at the University of Rochester, where I have a master's and a PhD in chemistry. But again, you know, everything was not easy. My parents were continuing to get sicker. I had to go home more often. My only grandparent, which was my maternal grandmother, passed away from Alzheimer's disease very rapidly. It was rapidly progressing. And I had a graduate advisor who I had many differences with. It was quite a struggle to have somebody not understand you culturally or understand where you came from as far as demographics and being, you know, an underrepresented woman in the STEM fields. And so I just continued to have some of those identity problems. But I maintained those relationships with my mentors at RIT. I think they really helped me get through some of these different struggles. However, I decided to take a leave of absence once I finished my master's qualifications, because the stress was just too much between, you know, my own personal problems, my family, and everything. And so here you can see my dad, who was always a jokester, and my mom. This is actually a few months before she had passed. You can see that despite all the pain and struggle that she went through, she was always had a smile and always wanted to laugh and find ways to make other people laugh. But unfortunately, they both passed within a few months from each other in 2009. So that was while I took my leave of absence, and of course that just sent me down another spiral. I was getting myself into trouble, drinking, other things like that. And I just needed to find my way out of that. And so I during my leave of absence, I stayed with my aunt, my uncle, and I worked at a local grocery store. But that wasn't for me. I had a master's in chemistry at that point. I was not ready to go back to school. And so I had a friend encourage me to join the Army National Guard. I did not really know what I was getting myself into at that point, but I don't regret it at all. And so I joined the National Guard in 2009 as a logistics officer, and I've had different positions. I was basically what you would call a drill sergeant, but it's for training new junior officers, a training, advising, and counseling officer. I did that for multiple years. I'm a military police officer. I was recently called to duty for some of the civil unrest that we had been experiencing in this recent year. But the military is what really helped get me on that right path, right? It gave me the discipline I needed. It gave me a direction for where I wanted to go. And eventually I did transfer to the Army Reserves. So I'll talk about some of the things I'll be doing with that actually in the upcoming months. And so now I'm actually an officer in the Army Reserves. And after about 2 years of taking time off, I did go back and complete my PhD. But one of the things we talk about in the Army, and I think this is important for all of you to consider now, are right, your values. And so we have the 7 Army values, which are loyalty, duty, respect, selfless service, honor, integrity, and personal courage. And that acronym it spells out leadership. And so many of you hopefully have grown up with these same values or other values based off of your own family life or cultural upbringing. And so as your students now thinking about those values that you might already have, if you're not sure, maybe pondering on some of these Army values, how can you reflect these in your daily life as a student? Maybe some of you are non-traditional students. You might have different concepts of duty as a non-traditional student. And so if we walk through them as loyalty, right? What does loyalty mean? As a military person, right, it's loyalty to the Army, right? But as a student, what does that mean? Loyalty to your family, loyalty to your university, loyalty to your friends, and loyalty to yourself, right? Duty, again, as a student, right? I think that includes your homework, doing your assignments, showing up when you should be showing up. But again, if you might have other duties, especially if you're a non-traditional student, or if you maybe you have children of your own or younger siblings or family that you also have duty to, or even a job if you're working as well. Respect, right? That's really, really important. Respect to other people, respect to your faculty, to your peers, and then also respect for yourself as well, right? I lost a lot of that respect for myself in my younger years, and so that's where I ended up in some of these bad places. And selfless service, right? So volunteering, what are you doing as a student volunteering for others? You know, selfless service. I give talks like this all the time. I don't get paid for these. I think it's important people hear my story and hopefully it encourages them. But a lot of my research is meant for communities. I don't do it for myself. I do it for my community. Honor, right? Who are you honoring? And what you do in your daily life as a student. A lot of what I do is to honor not only my parents, but also my elders, my community, my family. And so again, thinking about what you do regularly, is that bringing honor to yourself and to those that you represent. Integrity, that's an important one as well. Academic integrity, you probably heard a lot, right? Don't cheat on your exams, things like that. That's obviously very important, but it's not just about what you do on your exams, but in your everyday life as a person. Do you have integrity? Are you willing to do the right thing, even if it means not being recognized for it, helping people out and things like that? And then finally, personal courage. That can be different for everybody, right? In the military, it's, you know, being able to put yourself out there and risk your life for your country, for your comrades, and to be willing to put your life on the line for everyone. In college, that could just be filling out that application for graduate school, putting yourself out there. It takes a lot for students who, especially first generations, that don't have someone before them telling them that they can do it. And so for you as an individual, as a student, what are you doing that shows courage, and how can you get over some of those fears that you might have? Again, really happy to expand more on my role as a military officer. Feel free to reach out to me if any of you are considering maybe a career, or if you are currently serving in the military. So I did go back to school, like I said, after about 2 years off, between all the training and everything. It took about 2 years. But again, I went back to the same lab. Academic advisor, we still had a lot of issues. I had my military obligations, and so I had just lost both my parents, so I felt like there was a lack of empathy. And the mentoring relationship just wasn't great. And I don't want that to sound like he was a bad mentor. It's just sometimes they're not a good match, right? And so it's important for those of you who are looking for mentors or thinking about PhD programs that I always think the mentor relationship sometimes is more important than the project itself that you're going to be working on. And obviously, you want to be working in a project that you're interested in, but if you have a mentor that is not going to support you, it's going to make that project even harder and that graduate program even harder to get through. And so eventually I was introduced to Dr. Cliff Pudry right before I graduated. That's him down here. I'm not sure if any of you know who he is, but it's the Linton Pudry Leadership workshop that they have named after him. And so he's also Seneca, and he was at the NIH. And he continues to be involved in my life as a mentor. In fact, he's going to speak for one of my programs in the upcoming months. So I defended my PhD in December 2012 with a graduation date of 2013. This is myself and my brother and my little nephews. They're not so little anymore, but and so I went off, and I'll talk about my postdoc positions here shortly. And so it was up until the end of my PhD where I realized that my academics I was letting them define me. I thought that because I did bad in a class or I did bad on an exam that I was this horrible student. So remember I told you in the very beginning of my career, I totally cut my GPA in half, and I had a lot of negative backlash either to me directly about that. I had a teacher once tell me biochemistry is hard. They didn't think I was going to make it, and so obviously that doesn't help as well. But then eventually, I dug myself out of that hole. I improved my GPA. And now all of those comments changed about me, right? I have multiple awards. I think I'm on the right career path right now. And people were saying all these positive things about me. And so, again, just think of it as a snapshot in a very long story if you're struggling in maybe some of your courses and realizing that you may have to work hard to dig yourself out of that hole, but that hole isn't going to define you. You can definitely improve. And so, if you weren't aware, I was the 2018 Professional of the Year. And so none of that would have happened without all the support that I've had throughout my childhood, my academic career, and now my career as a faculty member. And again, I was that bad student, but I worked hard to turn that around eventually. So like I said, I finished my PhD and I went to the National Institutes of Health. So this was my Army patch when I was in the New York National Guard, and I became involved with SACNAS when I went to the NIH. And so if you're not familiar, hopefully you've heard about the NIH. It's been all over the news with COVID and Dr. Fauci and everything. And so it's located in Bethesda, Maryland, about 30 miles outside of DC. And so I was there for 2013 to almost 2016. And while I was there, I worked in the National Institute of Neurological Disorders and Stroke. So I looked at viruses that affect the nervous system, so HIV, herpes viruses, different things like that. I'm not going to go into a lot of the research. Again, happy to talk about my research more. But I think the main thing I got out of my experiences at the NIH was building my network. So I met a lot of STEM professionals, both native and non-native. Myself and two others were the only native postdocs out of 4,000. And so anytime they wanted a native perspective, there weren't any native faculty at the NIH. And so we're kind of one of the higher tier natives. And so this is myself with some other native leaders You may or may not recognize any of them, but this is Dr. Collins, who was and still is the director of the National Institutes of Health. Here's myself and some of the other Native scholars. Eventually, we formed a group and we started to bring in more postdocs and summer students and even some postdocs. And here we are at the National Congress for American Indians down in DC. Here's some of the summer students that we started to recruit. Here's a picture of an article. And now these are actually some of my students, my high school students that I bring to AISES with representatives from the National Institutes of Health. And so through my work and efforts with others, we really helped to push this, what is now the Tribal Health Research Office. It wasn't there while I was there, but we really thought it was important that they have the Tribal Health Research Office. And so they take a lot of the student initiatives under that office. And I'll provide the contact information if any of you are interested in opportunities at the NIH. But the research I was doing, it was interesting, but it wasn't quite what I wanted to do. And so I took another position at the University of New Mexico. It was NIH supported. And there I went and started doing work with vaccines. I also did more of a virtual program through the Centers for American Indian and Alaska Native Health out of the medical school there in Denver, Colorado. But it really was my mentors. They are all I had this idea that I knew I was a trained bench scientist, but I wanted to work with my community. I just didn't know how to get there as a bench scientist. And I didn't want to be a physician still. And so it was really working with students, working with community members, and my mentors pushing me in these right directions. And so that's where I said I was involved with the vaccine research at UNM, and then more public health. That's where I started to be involved in looking at HPV and Native women. And I'll talk about that real briefly in a few slides ahead. And so that's where you can see my career goal is, including that biomedical, including that public health, and working with tribes, and then also working with students as well. And so then I started looking for faculty positions, and I applied all over the place. I had about 5 or 6 interviews. I'm not quite sure at this point. So I interviewed at some really prestigious schools. However, I was drawn to NAU because 1, I felt supported by the faculty there wanting to recruit me. And 2, I wanted to work with Native students. It was one of the only schools where they actually had a Native population, and I wanted to be able to make a difference with the students. These are some other organizations I'm involved with. So I was a co-chair of the Native Research Network. I have a certificate in public health. So even though I had a PhD, I continued my education, took some graduate courses through Johns Hopkins. So basically a certificate of public health means you've taken a bunch of graduate courses, but not quite enough for an MPH. And I'm fine with that. I don't need any more education, I don't think. Well, not right now. All right, so as I said, all of these different experiences really helped to shape where I'm at now in the research that I do. So I'm gonna just touch on them very briefly because I don't wanna take up too much of your time. But again, feel free to go to my website or reach out to me to learn more. And I also have all the links for how you could potentially join my lab. All right, so as far as biomedical, like I said, I focus on vaccines. And so I use this approach called community to bench, right? And so finding out what our community needs in our Native communities and how I can take that information through public health research and bring it back to the bench and start working on community, but the general population as a whole. And so when I take an approach to designing vaccines, right, we're determining the disease, what disease is affecting our communities. And so these are all the different ones that we're working on in my lab. So different infectious diseases, gonorrhea, AIDS, cervical cancer caused by HPV, and then others that are more chronic. So cardiovascular disease, which is CVD, and then also now the opioid epidemic. And then we've identified a target associated with this disease. So in most cases, we're looking at proteins. So viral proteins or something associated with a protein. In the case of cardiovascular disease, we're looking at apolipoprotein, which is involved with triglycerides. And then small molecules such as opioids in the case of the opioid epidemic. Then we determine our vaccine platform. So you might be hearing this a lot on the news, the mRNA vaccine, et cetera, et cetera. So we don't use those vaccine platforms in our lab. We use what are called virus-like particles. Those are what are currently used right now with the HPV vaccine and the hepatitis B vaccine, and then a new platform related to my graduate work, which there are currently no vaccines on the market, but we're trying to utilize this technology to develop vaccines using self-assembling peptides. And then at some point, we're just starting in my lab to do some preclinical work. So right before you do a clinical trial, you need to show that the vaccine will work in cell and or animal models. And so we're going to start working with mice with some of these different vaccine candidates. But again, it's really taking that that community to bench approach, finding things that will help, that are affecting or impacting our community, and bringing it back to the lab so we can then take that knowledge back out and develop vaccines for our community members. And so the opioid one is one of the ones getting more attention. This is in collaboration with my mentor at the University of New Mexico. We have a patent, so I can't go into a lot of detail, but basically what we're doing is we're chemically modifying some of these opioids. We're also working on methamphetamine and putting them on the surface of these virus-like particles and kind of tricking your body, right? We're saying you're tricking your body into creating antibodies against the opioid themselves. And so we have some animals data that I'm not going to go into a lot of detail over, but we do have a video. The link is embedded in this presentation. I can send you the link if you would like it to watch the video as a news article that was done. But again, opioids are important because they've been impacting natives for many, many years. It wasn't until more recently that it was determined to be an epidemic. However, it's been affecting our communities at the same rates as the white community. This is just one of my students. She's a recent graduate. She was working on this poster. So again, that's a lot of the work that we do in regards to biomedical. So as far as public health, right? Why is a chemist or a biochemist doing public health research? I think it's really important that I take this knowledge of basic science and apply it to these larger public health questions. And again, it goes back to some of these quotes that I've, the Lakota prayer. I also heard someone say research is supposed to be culturally neutral, but someone's culture is always influencing research. And so why not have a native or someone from the community working on these research questions and using our indigenous lens to address them. And then again, I had one community member say, stop researching us and start helping us. So that's very important too, right? Taking that knowledge, how can we actually use it and apply it and bring it back to the communities. So again, a lot of the work is around cervical cancers or different infectious diseases. Now I'm doing a lot of different community education projects around COVID with the being on the different coronavirus panels. So trying to educate community members and give them the information they need to make an informed decision on vaccination. But one of the ways we approach this, right, is, you know, we had a community come to us. They wanted to know why their women were dying from cervical cancer at much higher rates than the general population. And so we know HPV causes cancers, different types of HPV cancers, but we didn't know what the prevalence of HPV was in the native population because they're not usually included in these large trials. So that's what a lot of the work around HPV that I did that has been published. And so the references here down at the bottom. But what we essentially found in this study was not only were women infected with HPV at a higher prevalence, they were not clearing the virus over time. So typically, right, most individuals clear HPV naturally within 2 years. That's why we see in this blue line, in the general population, you see a large spike in the 20s where people are more sexually active, more partners, etc. But then over time, they will become infected and possibly just clear the virus. In our study that we did, you can see that this younger population had over 40% of the people or the women in the study had at least one type of these 14 cancer-causing HPVs. But over time, in this community, they were well above 20%. Some of them still had at least one HPV type that can cause cancer, and that's about 4 times more than we see over here in the general population. And we don't know why they were experiencing these high prevalence in the older populations. It was a little concerning, actually. But at least in the younger population, 16 and 18, they almost had none, right? And so HPV 16 and 18 are in the current vaccines. And so it's showing us that potentially the vaccines are helping reduce the amount of 16 and 18. But what about all the other types in this community? And we don't even know the types that are causing cancer in this community. That data is not readily available if it exists even at all. And so that's where, again, my work on designing vaccines for communities stems around what types of HPV are in our community and how can we develop vaccines specifically for our community. All right, and so now I'm going to switch gears and talk about my passion, right? Mentoring and STEM and education and working with the younger generations, right? And so a lot of it is developing programs by indigenizing STEM, making them culturally inclusive programs at various levels for our young students, high school and up, right? And so why is this important? So I'm sure most of you are familiar with the term indigenizing or indigenized STEM means, right? And that's using our traditional knowledge or the knowledge of the people originally from the land in our curriculum. And so this is a graph of high school, undergraduate, PhD, and professionals from the National Science Foundation who are graduating relative to their racial groups in these different years. And if you haven't noticed, these are the years that I was being active in my education path. And so you can see it's just the trend, right? The white and the Asian Pacific Islander, you can see those trends are going up. They're the ones graduating with PhDs and going off and obtaining professional degrees versus the Black, Hispanic, and American Indian, Alaska Native. Those trends are going down, and sometimes the data is even non-existent for that year in the Native population. And so that was really concerning, and why I'm a strong advocate for encouraging students into STEM. It's important. It goes back to that quote, right? Research is supposed to be culturally neutral, but someone's culture is always influencing research. So the year I graduated with my PhD, there was almost 50,000 total PhDs awarded in the US. And so of those US citizens, there were 25,000 that were white. And then you can see okay, so I got kicked off. I'm sorry about that. The internet is a little touchy here. I'm not sure how much of what I said was maybe not recorded. So I'm just going to start on this slide again. So essentially where I left off was about 5,000 physical science PhDs were awarded in 2013, and of those, 6 of them were only Native. And you can see how they're broken down by reds. So in all these other general physical science areas, you can see we did not have a PhD awarded to any of our Native This trend, unfortunately, has not changed that much. There may be a few more graduating than 119. I think I saw 1 year it was 150. And so we need to continue to improve that and to increase those numbers. And so we can have more Native Indigenous scientists out and representing our communities and using that Indigenous lens in research. And so again, I mentioned earlier that I'm involved still with the NIH in their programming. And so we submitted a paper on how we refined that their summer internship. And you can see that in the earlier years, they're having difficulty with recruiting students. And then myself and others came on board and we really upped the recruitment. And until COVID happened, they were meeting these projections of 20 to 30 different students in different institutes, just not the neurological disorders and strokes, but other institutes. And about half of them were returning and half were new students. And so we're hoping to continue to increase this trend even this year in 2021 with the pandemic still affecting things. Almost all of them are still in the health in the professional field and graduate program, etc. And so we have another manuscript that we're trying to get published. Oh no, I have unstable internet again. I hope I don't get disconnected. We have a second publication we're working on it, looking at Native identity. And so if you're an undergrad and you're getting ready to graduate either this year or even next year, they have a rolling application for postbacks. Unfortunately, they have already closed applications for their summer internship, but you can contact Dr. Angel de la Cruz if you're interested in a postback or a postdoc. If you're finishing a master's and maybe not sure if you want to go on to a PhD, I would highly recommend you contact Dr. de la Cruz. Again, this is just they're referring to the summer internship, but they also work with the different training programs for all levels at the NIH. And so now at NAU, I run my own program. We're going to be recruiting soon. So if you have any younger siblings, we're doing 2 virtual and 1 in person for those that will be 18 and live in the Flagstaff area. And so again, designing curriculum that is culturally inclusive. We have primarily Native students, but we also include low-income students, and so they could be of Hispanic, Caucasian, or Asian background. And so we want them all to feel included in this program. And so they gain experience in chemistry and biology and health sciences and research. Last year we did a completely virtual program, and we provided them all the supplies. And again, we'll do the same this year. But you can see this is our first summer where we had students at NAU, and then we took them to AISES. And I believe this was also supported by the American Chemical Society as well. So that's why we have ACS. And so here I am now at NAU. As I mentioned, these are my patches for the military. I was an MP. Now I am a part of the Army Reserves out of Task Force Oceana. In fact, in April through June, I will be down in Hawaii working on some COVID military-related missions. So using my civilian expertise actually in my military career now. So it's actually a really fulfilling position. It's not just what you see on TV. So again, if you're interested in the National Guard or the Army or any military career path, feel free on national COVID related panel. So the Coronavirus Prevention Network, which was more involved with the clinical trials. Now I'm on the NIH Community Engagement Alliance, or we call it SEAL. So that's about addressing misinformation and health disparities in at-risk communities across the nation. So I've been doing a lot of work related to COVID in the last year. And so not so much on my current research projects because we all had to shift gears a little bit. And so where am I going to next? I don't know. NAU is great. I'll probably be here a while. See if I move up and through the ladder at NIH, or I mean at NAU, or if I go elsewhere. But really thinking back about all of the different influences and how I got to where I am, right? It all started with family. And then I had some great mentors who came and brought me under their wing and pushed me to the next level. And then I joined the military and I found that motivation and training that I needed to get myself back on the right path. Networking is very, very important. So hopefully you all are starting to do that now at a young stage in your career. And then gaining that confidence to realize that I can do this. I am important. My opinion is important. My traditional knowledge and what I bring to the table is important. And you can see it wasn't one of the first ones. And so where am I going next? I don't know. This is me with my screaming some days. Oh, so stressful lately. I'm sure you guys are all have the same stresses as well. And then my brother sitting next to me like, girl, please. And so we'll see where I go next after here. So again, if there's anything I want you to take from this is remember who you are, right? You all come from different backgrounds, with unique perspectives, with different experiences, and depending on how you identify, it's important that you bring that all to the table and you use it to your advantage. And so for me, again, right, knowing that I'm an Indigenous woman, I'm a wife, I'm a stepmom, I'm an aunt, I'm an educator, I'm a mentor, I'm a military officer, right? Not separating any of those and using them to represent me whole. So if you're interested in learning about opportunities at NAU, I have affiliations across the university. So if you're interested in more public health or health science, you can still join my lab. If you're interested in more the STEM, biology, biochemistry as well, we have our programs that here because a lot of them are virtual. And so again, if you're interested, just let me know. You could be part of, whether you're a high school student, a summer person, an undergrad or grad student, there's opportunities to join my lab or others here at NAU. And so with that, I will say Nyawe. These are current members of my lab. Actually, it's not most current. I've had some new ones join. My colleagues, some of my mentors here at NAU, and then Dr. Jakirian and Dr. Freet, who are at UNM working on the opioid work with me. So again, my contact information, follow me on Twitter, or you can just check out my lab website. So again, feel free to reach out. Nyawe Eskongiai.